At the start of the pandemic, we had no foundational elements to how to address the problems. We had the Metro Denver Partnership for Health work. We had done a lot of work together on other things. We then unified our efforts to develop a regional approach for how we were going to address the pandemic, from containment, surveillance, and testing all the way through vaccinations and schools. We did that with equity in mind in every step of what we did to ensure that all people could have access to the services they need. And we highlighted the long-standing issues of inequities we had seen many times before, but now were very clear during the pandemic.
The reason we needed a regional approach was threefold. One is we had a lot of sectors that we were working with that did not work by county boundaries, like our school districts, our healthcare system partners, and others. Secondly was from an equity perspective. We know with this pandemic, it does not live within county boundaries or lines. With that, we really needed to make sure that we came together from an equity perspective. Lastly was the political aspect of this, when we needed to implement public health orders and the ability for us to come together and lean on each other.
We noticed the disparate impact that COVID was having on our priority populations, which include people of color, people identifying as LGBTQ+, people without documentation, people living with disabilities, people in mountain communities, seniors. And we knew that we had to focus on our priority populations.
We built a number of plans which helped to develop the systems and structures to put in place to support segments of the population that were most at risk. We also built priority population plans to ensure that we all had equity-based strategies that we were using across the Denver metro area. And collectively, by working across counties, we created a shared vision so that way we could serve all the different populations best.
The Metro Denver Partnership for Health is well positioned to take on complex issues going forward. And the reason for that is we had worked very closely together in the past, but COVID really put a spotlight on those social and health inequities that we see in our society.
I see this as the beginning. We started in the right place, but it would be a shame to stop now. We need to evaluate this work through the lens of learning, organizational learning, as well as community impact.
I'm grateful to have worked with an amazing group of partners from both the local and state level, and it has been this collective shared vision that has really helped us all to get through the pandemic. And our residents cross borders every day, and so as a region we were able to successfully implement these strategies, and it made a difference.